So we all know how common rows are, and they're usually a big part in any sort of workout, fitness, or rehab plan. In addition to how common they are, there's a ton of variations. You can use cables and barbells and dumbbells, right? But the one thing with a row is that there's an undetected and overlooked compensation that usually happens in every single row. It doesn't really matter what type of row you're performing, usually this compensation is there. And in this video, I want to discuss what that is and how we start to address it. Now, before we can discuss what the main compensation is, we need to talk about what a row should be and what a row is. Now, for this video, we're talking about a traditional row where we are trying to truly work our back muscles. Obviously, it depends on your intent and the person you're working with as far as any sort of modification, but think about just a traditional row where we are trying to work the back muscles. So a row is a scapular retraction exercise. So the idea is this scapula should be moving towards the spine and then protracting and going away from the spine. The problem that usually happens is that the exercise moves away from a scapular retraction exercise and it turns into a humeral extensor exercise. And this is the main problem. A lot of people get caught up in the arm because that's what they can see, and they miss the true point of the exercise, which is actually back here. So that brings us to our main compensation, excessive humeral extension. What usually happens is that our patients and clients think that there is a correspondence or correlation to more humeral extension equals more scapular retraction. The thing is, when you go through humeral extension, there's a point when the shoulder is just going to roll forward. When this happens, you're not actually retracting the shoulder blade. You're just going through that shoulder joint. Now, here's the thing that also adds to it is that a lot of our patients and clients have really restricted glenohumeral joints. The actual joint's pretty tight. So what this is going to do is as they approach this by the side body position, they stop retracting. They continue to go through humeral extension and they just roll forward and compress that shoulder joint. So what we need to do to fix this is, one, make sure our patients and clients are aware that we don't need to end super far back when it comes to our elbow position. Ideally, we're ending in line with our side. But when they end with their arm by their side, they need to truly feel these back muscles contracting. So many of our patients and clients go through a row and never truly feel their back. Ask them next time they're performing a row, where do you feel it? A lot of times it's shoulder and the arm. So in order to really get the back, we need to make sure they know how to truly protract and retract, and then how to line and sync that up with the elbow and the humerus going through extension. So a simple drill I like to do with my patients and clients is that before we use any sort of weight when we're rowing, is that we first need to understand how to protract and retract. And we do this with a straight elbow, right? We're breaking it down into its components. So instead of trying to do it with a bent elbow, keep a straight elbow. So as we go through a straight elbow, protraction and retraction, all we're doing is seeing if they can do it, because you'll be surprised. A lot of patients and clients struggle with this. They really like to hike up. They really want to bend their elbow. So we need to make sure that they have the ability to actually retract that scapula around the spine as they're doing a row. Now, once they understand how to do this, then we start employing that elbow to really get the elbow flexion and the humeral extension. Now from there, we need to ensure that they can get to a point where they're pretty much by their side and they truly feel their back muscles. That's the difference. A lot of times we go through this, but we don't ask them if they truly feel it. So we need to do a couple repetitions where they start to retract and they bend. When they get to this end point, do they feel their back? If they don't, they probably need to retract a little bit more. And they're going to have to go through a couple repetitions to make sure that they understand how to do it, but also, are they feeling it? Once they start feeling it and they have the confidence with the motion, throw the weight on, go crazy, go wild, do whatever you feel is necessary, but make sure that your patient and client continues to perform the row the right way.